I bet we've all had that feeling. Staring at some official form, maybe government paperwork, and just feeling completely lost.
Oh, absolutely. Like you're in a maze.
Exactly. Especially when you're already dealing with something difficult, like an injury, the confusion, all that paper, it just feels like hitting a wall.
Mm-hmm.
But what if there was a clearer way through? Maybe even a direct path designed to help. Okay, let's unpack this. Today, we're doing a deep dive into a system that a lot of federal employees have to navigate. Federal workers' compensation.
Right. The OWCP system.
Yeah, we're going to explore a really interesting resource that's emerged, one specifically built to guide people through the complexities of the Office of Workers' Compensation Programs, the OWCP.
Which is part of the Department of Labor, the DOL.
Correct.
And it's important to stress this isn't just, general bureaucratic hassle. Federal employees could be postal workers, TSA agents, VA nurses, maybe IRS staff, AFGE members. They face really specific hurdles after a work injury.
It's more than just confusing forms, right?
Yeah. Oh, much more. It's often subtle things like a claim getting denied for a tiny technicality, a missing phrase maybe.
Wow.
And they really struggle sometimes to find doctors who actually get the very specific rules under the Federal Employees Compensation Act, FECA. There's just been this huge ongoing need for clear, really actionable guidance.
And that seems to be the niche the OWCP.DOCTOR Podcast is trying to fill.
Exactly.
It was launched pretty recently, June 2025, by the team over at Restore Muscle and Joint. And it's not just another health show.
No, definitely not.
They're laser-focused, is the term they use, on federal workers' comp issues. And crucially, how to solve them. They seem to deliberately avoid the general health topics.
Which is smart, I think, and the people behind it bring some interesting experience.
Tell us about that.
Well, it's co-hosted by Troy Pearson. He was actually a USPS federal employee for 7 years, so he knows the system from the inside, you could say. Now he's co-owner of Restore Muscle and Joint.
Okay, so firsthand experience.
Right. And alongside him is Dr. Kendra Pearson. She's an experienced chiropractic physician, owns the clinic, and she's done media before, hosted a radio show called The Wellness Advocate.
So she knows how to communicate complex stuff.
Precisely. So you get this combination, this sort of balanced and experienced voice tackling these really quite nuanced issues. They seem pretty uniquely positioned, I think, to talk about the specific hurdles federal workers face.
Okay, so our mission then for this deep dive is to explore how this podcast and also the clinics connected to it, Restore Muscle and Joint, how they're aiming to, simplify this whole OWCP process.
Mm-hmm. Empower the workers.
Yeah, empower injured federal workers.
Yeah.
And help make sure they get the care and, the compensation they're entitled to. We should probably dig into some of the specifics they cover.
Definitely.
You mentioned those minor reasons for denial and confusing forms. It sounds kind of abstract, but that's where people really get tangled up, isn't it?
It really is. That's often the sticking point.
Does the OWCP.DOCTOR Podcast give concrete examples, like a specific technicality that often trips people up, and maybe how they suggest getting around it?
Absolutely. They do that quite a bit. One really common point of confusion they highlight is the difference between the CA1 and the CA2 form.
Okay.
The CA1, that's for what they call traumatic injuries, something specific that happens in a single workday, like slipping on a wet floor.
Got it. An event.
Right. The CA2 is different. That's for occupational diseases or injuries, things that develop over time, repetitive stress, maybe, or exposure. Carpal tunnel from typing all day, for instance.
Makes sense.
But here's the key thing the podcast hammers home. For that CA1, the traumatic injury form, there's a critical 30-day reporting window.
30 days.
Yes. And missing that deadline, even by just 1 day, can seriously jeopardize the whole claim.
Wow. So it's not just picking the right form, it's the timing and probably how you fill it out, too. That sounds like classic bureaucratic complexity.
It really is. And you mentioned filling it out. The narrative part is huge.
The description of what happened.
Exactly. That initial statement on the CA1 or CA2, it can genuinely make or break a claim. It's that important. Yeah, a lot of employees might just jot down a quick sentence or two. But the podcast points out that OWCP reviewers are looking for very specific things.
Like what?
Well, the mechanism of injury, how it happened, the specific body part. And crucially, what's called the medical nexus. That's the direct link they want to see between your job duties and the injury itself.
Okay, so you need to connect the dots very clearly.
You do. The podcast often gives templates or phrasing suggestions, guiding you to say something specific like, While lifting a 50-pound mail sack, as required by my duties, I felt an immediate sharp pain in my lower back pinpointed at the L4, L5 level.
That level of detail.
Yes, that kind of explicit connection helps stop the claim from getting flagged right away for, insufficient evidence. They talk about how OWCP often looks for reasons to deny early on, so that narrative is really your first line of defense.
That's incredibly useful, practical advice.
Mm-hmm.
Not just theory, but almost like a step-by-step guide for the paperwork.
Mm-hmm.
And what about finding the right doctor? You said earlier that many don't really understand the DOL requirements. What kind of guidance do the podcast or the clinics offer there?
Yeah, that's a huge one, a major hurdle for many federal employees.
I bet.
A lot of regular clinics, they just aren't set up for FECA claims. They don't know the specific forms like the OWCP-5 or the CA-17. They don't understand the billing codes or the kind of documentation OWCP needs to see for things like maximum medical improvement, MMI, or if someone needs a schedule award for permanent impairment.
Right, it's a whole different system than private insurance.
Totally different. And that's where Restore Muscle and Joint comes in, the clinic behind the podcast. They aren't just a general practice. They specialize in this.
Mm-hmm.
They offer direct access to what they actually call OWCP doctors, physicians who are experienced specifically with the federal system. The podcast reinforces this too, talking about the types of medical reports OWCP wants. These often need way more detail, especially regarding causation, than standard medical reports.
So it helps patients avoid that back and forth of not enough medical evidence.
Exactly. They're trying to get the right documentation submitted the first time.
So the clinics aren't just treating the physical injury, they're preparing the paperwork with OWCP's very specific requirements in mind. That seems like a really significant advantage.
It's a major differentiator, yes.
Now, for someone listening, are there maybe common misconceptions about this kind of help? Or maybe situations where, even with expert guidance, the process is still really tough?
That's a really fair point. One misconception might be that if you just follow the steps perfectly, every claim sails through easily.
Which isn't always realistic.
No. The reality is, complex cases, maybe someone has pre-existing conditions or multiple injuries, those can still be a fight. Even with top-notch help, OWCP can, and sometimes does, deny claims. What places like Restore Muscle and Joint and the advice on the podcast aim to do is drastically reduce the chance of denial because of, avoidable mistakes. Errors on forms, missing information.
They maximize your chances, basically.
Exactly. They can't guarantee approval. Nobody can promise that. But they help ensure you're putting the strongest possible case forward because you understand the rules of engagement, so to speak.
Okay.
Another thing they often clarify is the difference between filing a notice of injury, like the CA1 or CA2, and actually filing a claim for compensation, like a CA7. They're legally distinct steps under FECA, but people often mix them up, which causes delays.
Just knowing that distinction could save someone a lot of headaches and waiting time.
Months, potentially, yeah.
It really highlights how crucial specialized knowledge is, particularly when people are vulnerable after an injury.
Absolutely.
So wrapping up this deep dive, it seems pretty clear how the OWCP.DOCTOR podcast and the Restore Muscle and Joint clinics work together. They form this sort of comprehensive support system.
That's a good way to put it.
The podcast gives that ongoing practical guidance on OWCP and DOL stuff, breaking down the complicated rules.
Making it understandable.
And then the clinics offer that direct help to federal employees, not just medical recovery, but really tackling that paperwork battle head on, getting the forms right, the narrative strong, the medical doc specific.
Yeah, I think a key takeaway is how Restore Muscle and Joint bridges that gap. It's about providing that direct access to doctors who know the system. Offering free claims help is huge, too.
Free claims assistance.
Yes, free initial claims assistance. And ensuring no out-of-pocket costs for accepted claims is another big plus. They offer support right from the beginning, the injury assessment through to trying to get the claim approved.
So they really act as an advocate.
Very much so. Which is vital in a system that can feel, frankly, designed to be overwhelming sometimes.
And you mentioned their track record seems pretty solid in getting claims approved.
Right. And for anyone listening who might be an injured federal employee, maybe in Missouri, Kansas, Iowa, Illinois, or Arkansas, where these clinics are located.
These combined efforts, the podcast, the clinics, they're really designed to help you feel well supported, informed, and hopefully more confident navigating that whole federal workers' comp process while you're trying to heal.
Yeah, less alone in it.
Exactly. So, okay, what does this all really mean when we step back? Thinking about how these specialized patient-focused resources like Restore Muscle and Joint have emerged. They're filling a pretty critical gap, right, where maybe few clinics really get the OWCP rules.
Definitely a gap.
Does that maybe make us rethink how vital that kind of niche expertise, that dedicated advocacy, really is when you're dealing with any big, complex, bureaucratic system, not just federal workers' comp?
That's a fascinating point. It really does raise an important question, doesn't it?
Yeah.
What are the broader implications when support like this offering, holistic care, focus on the patient, plus having a strong track record becomes this sort of rare but absolutely essential regional hub, especially for people facing these really specific, often overwhelming institutional challenges?
It definitely makes you wonder.
Yeah. It makes you think about how many other complex systems out there could really benefit from that same level of focused expert